There's no doubt that we live in tough economic times, and for that reason I've been thinking about why people would pay to come for acupuncture and Chinese medicine when we've got a free NHS service. You can go and see your GP, that's free at the point of use. You can get medication, which is often subsidised. So why would anybody choose to come and have Chinese medicine? There's lots of ways of answering that question. I suppose the simplest way would be to say why people tell me they come, which is often that they can't get a GP appointment for 3 weeks, or that they see their GP but they don't actually feel that the GP understands what they're saying, and so even with repeated visits they don't feel that they're actually getting the problem addressed. Other people come by recommendation. That's quite a high percentage of people, and usually that's again when people haven't received what they need from Western medicine, and that means that acupuncture tends to be a last resort rather than a first resort for people. So sometimes that makes me smile, because I think if everybody's coming as a last resort, it's a wonder I ever get results from anybody if they come when all else fails. But actually, I would like to talk about it from my perspective as well, and my experiences in clinic, because there's, over the last 18 years since I've been a healthcare professional, I've come across many, many different situations. And I have to say that if I was a GP who had 7 minutes with a patient, then I don't think some of these experiences would have happened. So to give you an example, I suppose I'd like to begin with the fact that a lot of the healing process is about being heard and feeling that somebody understands what's wrong with you and what you're trying to communicate. And in fact, I've had people ring me up and say, I don't want acupuncture, I'll pay you the same amount, but I just want to spend some time with you so I can understand what's wrong with me or understand the diagnosis. And I find that really sad, that people are in that situation, that they've been given medication or a diagnosis and they don't really understand what it means. And I think the biggest difference there is a GP has 7 minutes with somebody, whereas I have an hour and a half to get to know them in the initial consultation, and then subsequent treatments are about an hour long, sometimes more. So I really get to know the person, and I get to know what's normal for them. And I also find that I get to the crux of it. An example of that is if somebody comes in with backache, they may be told, you know, you've got backache because you've got a frozen shoulder, or because you've got poor posture, and you just need to go and do some physiotherapy and do some exercises, take some painkillers and you'll be fine. I don't look at it like that, and other complementary therapists, alternative therapists don't either. We say, okay, you've got backache, yeah, you've got bad posture, yeah, you haven't got backache because you've got bad posture. Why have you got bad posture? Oh, I don't know. I slouch. And I say, okay, tell me a little bit about you, about what's gone on in your life and where you work. And then as they talk about their work or the stresses and strains in their life, I see their dantian, their upper dantian collapsing, and their shoulders go round and their head goes down. And the chi sinks. The person talks about work and says, oh, my boss beats me up, or oh, I have a hard time in work. And you know, you can just see the energy draining out of people. Well, of course that's going to have an impact on people's health. But sometimes it's more serious than that. Sometimes when in the initial consultation, it can be quite taxing for people to talk about themselves for an hour and a half and to be asked about emotional issues. And I don't know whether it's a sign of the times, or you know, maybe people are more free to talk these days, but I've found, sadly, in a great number of cases, there are people whose problems aren't just down to physical pain. They're down to sometimes child abuse, and there have been many occasions when that's come out in treatment, and I've asked people about major issues in their lives or major changes or something like that, and they'll start talking about abusive relationships or abuse in childhood and extreme emotional situations that cause them to collapse in on themselves, and that may cause backache, it may cause digestive problems, but one thing's for sure is emotional trauma has a physical effect on the body sooner or later, and there's no way a GP can get to that crux of what's going on in the space of 7 minutes. There's another situation that I can give as an example, and it relates to treating children. So there was, I've had instances where I've treated children supposedly for ADHD. And I remember the first time I had a child come in, he was 7 years old, he'd been diagnosed with ADHD, and he had close family members who were conventional Western medicine practitioners who had given him medication, and it didn't help. And again, in desperation as a last resort, he was brought to me to see whether acupuncture could do anything to help. And I had the initial consultation with the child, and there was a very definitive time when this bad behaviour started, and it transpired that that child had been sexually assaulted by 2 other children. You know, a 7-year-old had been assaulted by an 11-year-old and a 14-year-old, and didn't feel able to talk about it, and that's why his behaviour changed. But again, if he couldn't talk about it and didn't feel able to tell anybody because he was ashamed, his behaviour was crying out, but it was misinterpreted as him just being a naughty boy. And if I hadn't had that hour and a half with him to listen to his story, then maybe I would have just thought he was a naughty boy anyway. And if there's one thing that this job has taught me, it's not to take things at face value, because it's easy to have a physical pain. It's very acceptable to come in with backache or knee pain or headaches, but actually that's just the body trying to tell us something, and something that's going on inside. So in 7 minutes, a GP can't get to the crux of what's going on emotionally. I'm sure many of them would love to, but the NHS is too stretched for them to have the time to do that. So what I find is, as a practitioner of Oriental medicine, people come here, they have an hour and a half to open up and tell me and be heard about what's really going on. And then that builds a bond. I get to know them. In some ways, it's like the family doctor used to be when I was little. You know, I'm nearly 50 now, but certainly as I was growing up, the children would be, the children would be known, the parents, the grandparents, the doctor would know everybody and probably have delivered the children and then delivered their children. So they knew what the family history was and they knew what was normal. And again, that's what I've seen in my clinic. When people come either regularly for appointments or if I've treated them for a number of years on and off, I start to recognise what's normal for them. And because Oriental medicine can be used preventatively, that's predominantly what the Chinese would say about it, I can see things on the horizon when I look at the tongue, when I take the pulses, when I use the other diagnostic tools that we have, that would sound a bit strange to a Westerner, but in Chinese medicine it's a very normal way of observing a person. You start to see if, for example, they're not responding to acupuncture in a way that they usually would. I've had instances where that's happened, and in one case there was a lady who was a single mum, and her pulses just weren't responding as I knew they usually did. And one thing led to another, and I asked her to go for a mammogram, and she did, and unfortunately she did have cancer. The pulse qualities change, the tongue changes, and so these things can sometimes, not always, but can sometimes be spotted as a conventional medicine practitioner gets to know their patient. And of course, early diagnosis means better outcomes. And so that continuity of care and being able to be there, being able to get an appointment, and having the ongoing story and getting to know the person and their family circumstances, and sometimes they're in the most secrets. There's many a time when people can come and open up to the therapist or practitioner such as myself with things that they can't tell they don't want to burden their friends or their family with, but they will tell people in the confidence of a treatment environment that's relaxing and homely, but at the same time professional, but not cold and indifferent, like sometimes is the case when you go to a Western medicine practitioner. So there's some of the reasons that I see acupuncture can benefit people, or herbal medicine, or any sort of complementary therapy really that gets to the crux of the matter rather than just treating the symptoms. I think one of my main bugbears really with Western medicine, that I think Chinese medicine really fills the gap beautifully, is that we regard nutrition as the core of anybody's well-being. Your food is the building blocks of your life, and so all of us are trained to some degree or other in nutritional therapy, or Chinese dietary therapy as it would be called with a TCM practitioner. I've also been trained in to be a nutritional therapist in a Western sense as well, which is actually different, because in China they would look at the energetics of the food. What do you eat that makes you feel hotter? A chili. What do you eat that makes you feel like your head's being blown open because it's so strong, like garlic or horseradish. So we look at the energetic qualities of the food, whereas in Western nutritional therapy, everything's broken down into molecules. How many molecules are there of this? How many vitamins are there? And everything is very kind of formulaic in Western medicine, and that there's a place for that. But what saddens me is that GPs and most Western medicine practitioners don't learn anything about nutrition. That's the building blocks of life. How can your body recover? We've got our own internal pharmacy, okay? If we've got our own natural pain relief, we've got our own hormones that regulate everything else in our body. All we need to do is nourish them properly, and then our body can heal itself if we just give it the chance, or give it a nudge in the right direction. But sadly, if you go to a doctor, they peddle drugs. That's just what they do, to suppress the symptoms. And that's where I feel very strongly that Western medicine is a disease care system. Just as I was saying before, oh, you've got backache because you've got arthritis. No. In Chinese medicine, we look at the energetics, we look at who you are. So you've got backache, okay, yeah, maybe you've got arthritis, that's a Western label, but why have you got arthritis? What imbalance is going on in your body that we can correct or nudge in the right direction so that your body can heal itself? We're not into suppressing symptoms. We deal with addressing the root cause predominantly, and using your food as your medicine, and explaining to people what that means. It's a lovely cliche, and everybody knows Hippocrates says, let thy food be thy medicine. But there are very few practitioners around of Western medicine who can explain to people what that means. They'll just say, cut out the fat, cut out the sugar, don't eat as much salt. And that's too simplistic. I, for example, need to eat more salt because I've got ridiculously low blood pressure, so I need more salt in my diet. And people who want to lose weight, telling them to just cut out fat is dreadful. You've got to cut out the bad fats, but you've got to know the difference between good and bad fats, because certain vitamins, A, D, E and K, are fat-soluble vitamins. So if you stop having all the fats, then suddenly you cut out a lot of the vitamins as well. So people need to understand how to heal themselves with their food. And then if food and exercise and nourishment isn't enough, then I would look at giving somebody herbal medicine, which would be tailor-made to fit their needs and to address what's going on in their body. It's not one size fits all. Everything is different. We are all different. And that's why in Chinese medicine, we don't label illnesses. So if somebody rings me up and they say, do you treat asthma? No, I treat people who happen to have asthma. Do you treat cancer? No, I treat people who happen to have cancer. And by the way, nobody can treat cancer apart from an oncologist. And if anybody else claims to, that's a criminal offence and we can be put in prison for it. So cancer is an interesting one to discuss, because Chinese medicine can help mitigate the side effects of the treatment of cancer. And I think there are certain times when Western medicine and Eastern medicine really can work well together. Because, for example, there's a huge cancer hospital in China where people are given the choice about what kind of treatment they have. And there's been research done there that shows if people are undergoing chemotherapy and have herbal medicine and or acupuncture, then they can manage the side effects of the chemotherapy, so the nausea, for example, much better. And that enables them to have a longer course of chemotherapy, which has better outcomes for their cancer, and the life expectancy was over a year better than it was. And that's about good quality life expectancy, not just existing. And so there are times when Western medicine and Chinese medicine really should be working hand in hand. And I wish that more Western doctors had the opportunity and the time to open their mind to working together. We need research. There's a lot of issues around research being done for acupuncture, and I think until all of that research is done, then it's going to be very difficult for people to get acupuncture on the NHS, or equally for people to be able to choose between the two, because you'd rather have something that's tried and tested, like Western medicine, than something that's a bit weird, like having needles stuck in you. But there's all sorts of reasons that I can talk about separately about why not as much research happens. But essentially it comes down to the fact that most of us are self-employed and don't have the time or the money to conduct the research. And obviously the pharmaceutical companies they're not facing that sort of problem. But that's a whole other ball game. Let's see. So they're just some of the ideas I have about why people would choose to pay for acupuncture rather than Western medicine. And I think it's going to be really interesting over the coming years to see that now the NHS is really, really struggling, even with critical care, and even to get people to hospital on time or to do hip replacements. And so a lot of people are being forced to have private medicine and to pay for private healthcare. And I wonder how things are going to go with choices being made, that if you've got to choose, if you've got to pay for your medication, then what are you going to choose? Would you choose to pay to see a GP, or would you choose to pay to have something like Chinese medicine where you can have the continuity of care, you can have an appointment when you want it, and you have a practitioner who actually gets to know you and your family? So there's, like I said, ideally we would all work together, but for that to happen there needs to be a lot more mutual cooperation between Western medicine practitioners. There needs to be more of an integrative healthcare approach, I believe, in the West. And if there are any GPs watching this, then I would really love to speak to you about how we could work together. And for any patients or potential patients, then just know that I think that, I would like to work with your conventional practitioner. They're your primary healthcare person. And I think we should all be able to work together to come up with a good treatment strategy with the patient's best interests at heart.